All right. Well, happy Friday, everyone. Hope you're having a good start to your weekend and early happy Father's Day to all who celebrate. Glad to have you here again. It's Friday, so NMQF is all about education, entertaining, whatever. Edutaining, I guess is the word. But glad to have you here today. We're doing a program on raising awareness around FSGS and rare kidney disease. And leading that panel will be our very own Dr. Britt Weinstock, who actually essentially was the first person to talk to me about health policy. A little bit of background, Britt and I worked together on the CBC budget back in 2006, where I worked on the tax part of it and she worked on the healthcare part of it. And then later I kind of got the healthcare part of it as well when she went to the Senate side. But it's great to have her. You're in for a treat because this is somebody that you've heard from before. But this is somebody that sort of has lived and breathed health policy for the last 20 plus years or so. And we were early in the staff meeting, we had this very esoteric thing, and Britt's like, "Oh no, that's actually at the Mayo Clinic. They're discussing that." So she is somebody with a wealth of information and knowledge that can more than helpful to lead this discussion. I'll just give you two little quick points. If you want to participate in the more want to participate more in the program, if you have a question, please put it in the Q&A box. And if you just want to keep the conversation going or you have some stats that you want to share with folks, put it in the chat box. But without any further ado, I'll turn it over to Dr. Weinstock.
Thank you, Brandon. And I remember section function 550, from our days. So good afternoon. Happy Friday to everybody. And thank you so much for joining us. I know that everyone is so busy. So we really appreciate you hopping on to this webinar, which is hosted by the National Minority Quality Forums Institute for Equity in Health Policy and Practice. I am Dr. Britt Weinstock, and I'm the Senior Director of Federal and State Policy here at NMQF Center for Public Policy. Today's webinar title is Raising Awareness Around FSGS and Rare Kidney Disease. This webinar is taking place at a really special time because on June 10th, a few days ago, was the very first FSGS Awareness Day. And FSGS is an acronym that I will use, but it actually stands for Focal Glomerulosclerosis. I can never say it, Awareness Day. But it was really an important day because it provided a moment to amplify patient voices, spotlight kidney care inequities, especially around rare kidney disease, and to mobilize action around rare kidney diseases that have, sadly been long overlooked. Before we delve into the discussion, I have to say this: FSGS is categorized as a rare kidney disease, but in the Black community, it's actually not that rare. Of the cases that we know about nationally, about 60% are among African Americans, and that's a really high number. But equally important is that FSGS sometimes is genetic. So even if you're the healthiest person ever, you can make all the right health decisions, but you can still genetically have this. The reason why it's also important to talk about is because FSGS is an extremely aggressive form of kidney disease. Unlike other kidney diseases, the progression from diagnosis to dialysis, the angle is very, very steep. And so it's really important for us to raise awareness, get the word out. And then it's also, the fact that people of African-American descent or Caribbean and African descent are disproportionately affected. There are other rare kidney diseases that have the same disproportionate impact across other racial ethnic minority communities. So we're going to talk about a bill a little bit later that addresses the rare kidney disease sort of space. But I just wanted to set the stage with that, which is just to sort of explain why it's so important that we're talking about this today. I think Brandon mentioned the Q&A portion. We're going to leave about 10 minutes of Q&A session at the end. So if you have questions that pop up, please throw them in the Q&A box. I have it open. I'm monitoring it. And we will try to get to you, when the time, if time allots. We have a lot to cover. So I want to introduce today's panelists. I am deeply honored to be even introducing these two women, Dr. Cameron Blackmore and also Chef Sachet. I'm going to give them a couple minutes to say who they are, who they work for, and what brought the two of you here today on this very busy Friday. So Dr. Blackmore, I'll start with you.
Hi, I'm Dr. Cameron Blackmore, and I serve as the Health Policy Advisor for Congresswoman Terry Sue, who represents the 7th Congressional District of Alabama, which includes the areas of Birmingham, Tuscaloosa, Selma, and the Black Belt counties that are in the central west part of Alabama. I come here today as a policy staffer on the Hill who has done work regarding rare kidney disease. And so I'm excited to take part in today's discussion and really explain the work that we're doing on the Hill and how we envision this work being impactful to rare kidney patients across the country.
Sashay?
Hi, everyone. Thank you for having me. My name is Sashay Walker, and I am a private chef and caregiver for my 16-year-old son who has been battling FSGS since he was 8 years old. So from the time he was diagnosed, I started getting involved in advocating for kidney disease because there was a lot of misinformation and a lot of things that we didn't know about the disease. And now, 8 years into our journey, I've learned so much, and so I've just become really passionate about kidney disease, especially FSGS, over the past 8 years. And with me working as a private chef and doing performance nutrition for professional athletes, it's very important. Diet and health is very important in our household. So thank you so much for having me today.
Yeah, and thank you for the both of you, Dr. Blackmore and Chef, being here. I know that your schedules are so busy, so we really appreciate you taking the time, and also for the perspectives that I know that you're going to share, which I think will be really profound. So as I mentioned, just as a quick recap, FSGS, it is defined as rare, but it's actually not that rare in the Black community. And one of the things that always startled me was to know that it's sometimes genetic, but also that there's just a lack of screening, there's a lack of awareness, and that doesn't just happen among patients or those most at risk. It's also in the provider community. So what we're going to be talking about today is what do we do about this, and how do we bring equity to this space that has long been overlooked. So that's the not great news. The good news is that there is a proposal before Congress. Dr. Blackmore's boss, Congressman Terry Sewell, along with Congressman Bill Arrakis, introduced the new era of preventing end-stage kidney disease act. It's HR 1518 is the number in this Congress. This is the third Congress that this bill has been introduced, the second that Congressman Sewell and Congressman Bill Arrakis have worked together on it. And it's bipartisan in a time when people aren't working together. They came together on this, which I think is really an important statement to make. But it really would positively change how we not only prioritize, but how we screen for, understand, and treat rare kidney diseases, all of them, not just FSGS, all of them. And it also includes really strong provisions to raise awareness among providers and also those potentially could be most at risk for a rare kidney disease to really help move the needle sort of in the right direction. So in a bit, Dr. Blackmore will speak more about 1518, HR 1518. But I'm going to start with a question to Chef Sashay, if I may. Please share your journey with FSGS, that of yours and your son, and just sort of educate folks on the phone about, or on this call, about what it actually is. It's got a very complicated, convoluted name, but what does it actually look like when you are the mother of, advocate for, care provider for, warrior for someone affected by this condition?
Absolutely. So FSGS stands for Focal Segmental Glomerulosclerosis, and it basically means that the filters in the kidneys that not only clean the blood, but filter out any minerals, salts, potassium, phosphorus, anything from our food and our drinks that we take in, those filters in the kidneys start to die off after a certain amount of time. They start to develop scar tissue. So the name FSGS more speaks to the symptom of what the disease does. It basically causes those filters in the kidneys to develop scar tissue and die off. So my personal experience was quite difficult. My son was 8 years old, and one day he just started swelling up like a balloon. And we weren't sure what the problem was. We went to the ER, and after 2 days of running tests, they ran some tests, some urine tests and some blood tests on his kidneys, and saw that we had a problem. That was January of 2017, and that changed our lives incredibly. We started a steroid treatment immediately with 12 weeks of prednisone therapy and plasmapheresis and albumin and Lasix, other type of protein and diuretic treatments. And unfortunately, nothing worked for him. We were initially told about a month into our hospital stay that he had minimal change disease and that he would just manage with medication. Long term, he would not need dialysis or transplant until well into adulthood. And unfortunately, Aiden was on dialysis within 6 months. His kidneys failed extremely quickly, and once we did a kidney biopsy about a month into our hospital stay, we found that it was FSGS. And that's something that's very common. One thing that I've learned about this journey so far is that this disease is very easily misdiagnosed because of the lack of information. And our nephrologist at the time did not specialize in rare kidney disease, and she did not know what to look for. So we had a hard time trying to figure out what would work for him, and he ultimately ended up on dialysis very quickly. Our first hospital stay lasted 9 months. We never went back home after we went to the ER. So it's been an incredible journey, but I've learned a lot along the way.
Yeah, thank you for sharing that and being so honest. And what you touch upon is just the aggressive nature of FSGS, and also why this bill we're talking about is so important, because the lack of awareness isn't just among those who are disproportionately likely most affected, but also among the provider community. So thank you for sharing that. I want to cue it to a video we have about another FSGS patient that I want to share with everybody before we delve into the conversation with Chef and Dr. Blackmore further.
Feels so good, so good. Yep. How was that? I'm Brian Kennedy, a Grammy Award-winning writer, producer, and composer. And today I am collaborating with David Rush to create an amazing, life-changing, uplifting anthem for FSGS. This collaboration means so much to me because I get to utilize my skill set to reflect what I've been through. My name is David Rush, and I have FSGS. Collaborating with people just gives you an opportunity to bring your best to the forefront with their best. You know, something that you may lack, they may be great at. And so it allows it both to be amazing together. I think it was like a... Feels so good. I feel so good. Yes, I love that. When I was diagnosed with FSGS, I just assumed my life was going to be over. I spent about 180 days or so in a dialysis chair and about 600 hours doing treatment. In a year? Yeah. Okay, wow. I experienced the ups and the downs of this journey, but I'm just happy to be here, to be real with you. I had these thoughts of, man, what if I'm not here? What do I leave behind? My family? There's all these thoughts that kept on going through my mind. And I was like, well, one thing I can do is continue to make music and just write about it. He's faced the same things I faced. We may have faced it different times, different ways, but we faced very similar. We can trade off, literally trade scar stories. We can literally go scar for scar. Man, wow. You know what I'm saying? Yeah. Feels so good, even though it don't seem right. But it's my life, and we gonna be all right. The purpose of this campaign is to bring awareness to FSGS and bring the whole community together. I want people to feel like this is a movement and that we're activating together. And everybody needs a theme song. So it's give them their own theme song, their own victory moment. We want them to connect, we want them to feel the energy, feel the vibe, know that they're not alone. If the music hits your soul, man, just feel it. And that's the best part about it, man, the connection that we have. Yeah. Naturally. Oh, real. And you too, sir, off camera. Yes, sir. The connection we have is undeniable. My name is Destin Fuller Hope. I'm a filmmaker, I'm a director. I'm directing this project we're watching right now, and I've got FSGS. I hope that when you're watching this, you know we're here. We exist. FSGS is a real thing, and FSGS does have a community. And I'm hoping that this campaign brings us all together. Hey, that's so good. That's right. So good. Don't you feel so good? It can feel so good. Okay. Anybody out there watching this, we would like you guys to make this anthem your anthem. Whatever it is that makes you uniquely you, we want you to add to this anthem. Dancing, singing, rapping, painting. We need you to play it forward. All right?
All right. So, I mean, when I saw that video the first time a few days ago, I got goosebumps. I have them again. I really have them again. And one of the things I hope that people really got from that, the attendees today, is that, again, we're calling FSGS a rare kidney disease, but in the Black community, it's actually not that rare. So I'm going to segue into conversations about what are some possible solutions. And Dr. Blackmore, I'm going to punt this one to you. If you could give us a brief overview of the New Era Preventing End-Stage Kidney Disease Act, HR 1518, and sort of the impact that it would have as potentially a game changer for those affected by and working with and providing care to patients who are either at risk or who are currently living with not just FSGS, but any rare kidney disease.
Yes, yes. So, first of all, again, thank you for having me today to talk about HR 15. This legislation prevents a bipartisan federal solution for ensuring that patients across the country who are diagnosed with rare kidney disease have access to better treatment options, but also that we're educating patients and providers on what rare kidney disease is, and to ensure that we're beefing up the diagnostics and testing. There are two components to the legislation that are particularly important, I think, for the patient community as well as the political and policy environment. The bill mandates the Department of Health and Human Services to evaluate rare kidney disease treatment methods that will delay or eliminate the need for dialysis. And we know dialysis can be very, very harsh to patients, both time-wise and on their body, having to take out time to go to sit multiple hours, multiple days out the week. It's very, very disruptive to a patient's life. So having treatment options that can bypass that, but also ensuring that we are building out the research infrastructure within the NIH. So a part of the bill calls for there to be a special center of excellence dedicated to rare kidney disease within the NIH, because we know we can't just lump in all kidney diseases. I think the thing that is fascinating about kidney disease is that people tend to focus on chronic kidney disease, where it's more so your lifestyle factors, like what you're eating, what you're being exposed to, like lack of exercise and things like that, that we miss out on the opportunities to have those discussions around rare kidney disease. And I think that HR 1518 definitely gives us the opportunity to have those discussions and to push for those needs to like dedicate resources to rare kidney disease within the federal environment.
Thanks, Dr. Blackmore. And I want to add something. I've talked about, FSGS and other rare kidney diseases. I'd be remiss if I did not add that right as we speak right now, the FDA is actually reviewing an application for treatment for FSGS. And so, we know that there's a lack of awareness. We know that folks who often have FSGS are just not even aware that they have it. Screening for it is as easy as a blood draw or urinalysis. But the hope is that if this application and everything goes well, then for folks who have FSGS, when they know about it, there will be treatment on the back end. So it's very important to sort of highlight that there is light at the end of the tunnel. And I'd also be remiss if I didn't mention that, I mentioned that this is what the Institute at NMQ, but Travere Therapeutics really is the champion in this, who sponsored this, who has taken a leadership role in looking at rare kidney disease, not just FSGS, but across the board, and really coming at it from an equity sort of perspective. So wanted to make sure I gave them a nod and a shout out. So, Chef, I'm going to punt this next question to you. If you had the opportunity to talk to a lawmaker or their senior brilliant staff, which you're doing right now, working in this, what would you want them to understand about families living with rare kidney diseases and about the positive impact that this bill could have to get folks to hop on this bill? From your perspective, how would this have changed, or how would this change your experience and your journey and that of your sons, this legislation?
Well, this bill is incredible because it's giving us an opportunity to get in front of this a little bit. The thing with FSGS is this disease targets everybody differently. And you have some people that do manage on medication that don't need dialysis or transplant until years into the journey. And then you have the very aggressive side of it, where a lot of patients, their kidneys fail within months of diagnosis and they end up requiring life-sustaining treatments like dialysis and transplant much sooner. There is a genetic and an idiopathic side to this. There's also the recurrent side. Transplants don't work for everybody. So I think what's important for everyone, especially what I want lawmakers to understand, is that we are struggling with getting a hold of this disease once we have it, because the way that things change at the drop of a hat. Aiden has had almost 30 procedures in his life, and he has he has hydrocephalus as well, with that he was born with. But I would have never known that those two chronic illnesses work against each other. And because the FSGS is so aggressive, it has affected other organs. And so he struggles with thyroid issues. His lungs, he tends to have pleural and pericardial effusion. Fluid builds up in his lungs and around his heart due to this illness. So if we can get early detection as soon as possible, we won't so quickly end up at the road of just dialysis and transplant, because we don't have any options outside of that. And I want people to really understand that dialysis is a form of life support. It is not something that you do and it's just another pill that you take. It's life sustaining, but it's not life extending. So we want options that are life extending, that aren't as harsh, because Aiden, because the disease is so progressive and because he struggles with fluid buildup in other organs because of FSGS, Aiden does dialysis 4 days a week for 4 hours. He has not been able to be in person for school since sixth grade. He's been virtual all these years. He's going into 11th grade. And it's very hard on a teenager to not be able to have a social life, to not be able to go to events without wearing a mask. This is a very awkward time for them in their own personal development. So all these things play into us just trying to get through a normal work and school day. So if we can have early detection, if we can make urinalysis and blood tests normalized and comfortable, that'll also help explain our complicated family history. As African Americans, we struggle with knowing our medical history because we don't know our foundational history a lot. A lot of those things have been erased. So knowing, most of us know somebody, have a family member on dialysis, has passed from kidney disease. You know, my dad jokes, everybody has an uncle on dialysis, you know? So, and these dialysis centers are rampant in our community. So there has to be something going on. And early detection not only allows us to slow the progression of the disease in our loved ones, but it also helps explain some of our past medical history that we've never had access to as African Americans.
Yeah, thank you for that. That's really powerful. So Dr. Blackmore, I'm going to punt it back to you. Given we've heard the chef talk about her journey, we saw the video. We know that you and your boss have taken a leadership role on this issue for the last couple of few congresses. What are the policy, like in terms of the space, what are some of the biggest policy barriers to moving this? Because there is the strong call from the, not just the kidney disease, but the rare kidney disease community for equity. So what are some of the hurdles that you're seeing in terms of advancing this legislation?
Yes, so like you mentioned earlier, Congresswoman, the office, we didn't always have this legislation. When that legislation was introduced in the 117th Congress, Dems were in control of the House. And so, you know, Dems, we tend to be very, very equity driven. Our caucus is very like a melting pot, different backgrounds and things, unlike our colleagues across the aisle. And last Congress, when our office got this piece of legislation, uh, our counterpart, which Congressman Gus Billirakis' office has been amazing. It's an amazing office on rare diseases in general. And they have always led on this effort. When they approached our office, they definitely wanted us to rewrite the bill text in a way that would make it appealing to the Republican caucus. And we know a lot of times that means erasing equity and marginalized communities and all of these buzzwords that we know are important to us, but that the other my colleagues across the aisle may not be completely comfortable with. And so luckily, we do have a great partner in Congressman Billirakis' office, and our office. We were able to ping pong the legislation to make sure that the way that the bill text was written, while we want to appeal to a Republican majority Congress, we also want to make sure that the message of the bill, which is to reduce disparities within the rare kidney disease space, that language was still there and still going to hit and target the communities of color that we want to target. And so the barrier that we face now is an environment where we're not wanting to spend money, even if spending that money now will result in savings later, because we know, to Chef Shay's point, if we can get early detection, then the treatment looks completely different, and a lot of times the treatment is less expensive. And so convincing my colleagues across the aisle to invest into legislation like this is going to be very, very tricky in this political environment, but it definitely helps. This when the bill was first introduced in the 117 Congress, there were I believe 15 co-sponsors. Last Congress we had 51 co-sponsors. I'm pretty sure this Congress will double that number. Have even more members, offices that are aware of this issue and wanting to actually move the needle in this space. But I mean, we have to do the work regardless. We know, to my point, introducing it in the 117th made it easier to get an increase in co-sponsors in the 118th, and doing that work in the 118th would definitely make it easier to get those numbers in the 119th. So regardless of what happens with this particular piece of legislation in this Congress, we have to know that doing the work, telling the stories, knocking on doors, making the phone calls, sending the emails to spread the awareness of this piece of legislation, and also of the impact of rare kidney disease, not even just in our communities, because yeah, we're disproportionately impacted by it, but this impacts everybody. And most health issues, I think the great thing about health is that, like, it's bipartisan. Most disease cuts across every group you can think of imaginable. So I think that despite the barriers that we're seeing in the headlines with funding cuts, they want to cut NIH and things of that nature, we still must do the work to spread the news about this field, to make offices aware of it, and to get more than 51 co-sponsors in this Congress.
Yeah, thank you for that, Dr. Blackmore. And this is a perfect segue into my next question for the both of you, Chef and Doctor. For the folks who are on this call, and given all that we've heard, what can people on this call do to help advance this bill? What can they do to then also in their communities with their respective positions help raise awareness about not just FSGS, but all rare kidney diseases? Because Dr. Blackmore, to your point, we're only talking about one rare kidney disease that disproportionately affects African Americans. There's another one named IgAN that has the same sort of disproportionate impact on Asian Americans. There's a gymnast, Suni Lee, who was affected by that, and everyone knows her story. She was a tip-top athlete and had IgAN, and it almost killed her gymnastics career. Luckily, she was able to get into a clinical trial, and what did she do? Went back and won the second gold medal. So to talk about the sometimes genetic nature of this, she's a perfect example. But for the folks on the call, what can we do? Is it calling our members? Is it calling all members? Is it calling the Tri-Caucus? Is it calling them and saying, hey, you should be on this bill if you're if you care about health equity, like what are some of the recommendations that you would give to folks listening? And I'll start with you, Chef, and then Dr. Blackmore. I'll put it to you.
I think all those things are really important. We need to get involved on the health policy side. We need to be talking to our state legislatures about what we can do. But I think before we get to that step, I think as African American people within our own community, we need to make it a habit and we need to normalize speaking about our health issues within our family. We do not know our own medical history, and it is incredibly alarming. I had the hardest time getting medical information about regarding kidney disease and just health in general from my family, trying to pinpoint where this came from in my child and how I prevent it from happening to another child or a niece or nephew. We have to normalize genetic testing in our community. And it is difficult. I understand our fear. We have been experimented on in this country. We have a long history of medical mistreatment, malpractice, medical bias, racism. Our symptoms, our feelings are ignored. I always think back to when Serena Williams, one of the greatest athletes of all time, was in labor and she was told that she was just doing too much when really she had a blood clot. She could have died. They found a pulmonary embolism. And it's like I am so aware of the medical mistrust that we have in our community, but we have got to start talking about these things within our community. Talk to your family. Through Aiden's journey, my sisters have gotten genetic tested. My sister found out she's the APO1 gene carrier for her kids. And she's like, I would have never known that I carry the gene that leads to FSGS. And so now she's able to do early prevention and watch her diet and stay exercised, doing things that can help prolong her life and the life of her family. I think we need to get involved in the health policy side. We just need to start by talking and making these conversations normal and comfortable, because these are not things that we typically talk about in our community. We are very much, this ain't our business, right? But as long as we stay tight-lipped, we will stay closed-minded. And that's not something that we can afford to do anymore.
Thank you. Can I add one thing, Dr. before? One thing I would say, Chef, is that I hear what you're saying about genetic testing. One thing that I do want to make sure that folks are listening know is that for a lot of rare kidney diseases, you don't need a genetic test. So for FSGS, it's a urinalysis or a blood draw, because genetic testing can be very expensive and it can be very sort of scary for a lot of people. And you talked about the APO1 gene, and that's a huge part of this, but not everybody with FSGS has that. So the disconnect, you have a larger number of people who've been diagnosed with FSGS. But I think the genetic testing is very important, but equally important is knowing that even a urinalysis or a blood draw can really screen for a lot of rare kidney diseases. And
Absolutely.
I think a lot more accessible, not just financially, but also just mentally for people, because you're typically giving one or both of those samples during any routine doctor's visit. So sorry.
Absolutely.
Dr. Blackmore, sorry.
No, that's a great point. And I also want to point out that a lot of the sticking points that we made between the 1/17th version of the bill and the 1/18th version of the bill was around genetic testing, like ensuring that we kept language in that would provide access for marginalized communities to have access to genetic testing. Because to Chef Say's part, I don't know why I got to it's my accent, the tongue twister. To your point, we don't know. A lot of us don't know our family history. We can't go back several generations, a lot of us, to pinpoint things that may be a problem for us or for our kids. And so having access to genetic testing is very, very key for, not even just kidney disease, but for a lot of different diseases. But to get back to your point about what we can be doing in regards to HR 1518, I think a lot of what happened last Congress was the patient advocate's voice, taking that time to call or email or stop by a member's office and sit down with their staff and explain exactly what this is. Like I said earlier, a lot of kidney disease, is lumped together and treated as such. And before we received this bill in our office, the Congresswoman did a lot in the chronic disease space, because it is such a big issue for our district. But I noticed, and the reason why I gave a quick yes to this particular bill was because the rare kidney diseases are kind of flying under the radar. So, there is a huge messaging component and opportunity that we have to make sure people understand, what the difference between the two are, and that, like, just because you have a poor diet doesn't necessarily, mean that you're safe. I mean, I'm sorry, just because you have a great diet doesn't necessarily mean that you're safe, from experiencing kidney disease. So, that was kind of the vision that I have for, like, putting her, like, in the forefront on this issue, and I hope that and I'm all ears for ways that, you know, our office can be doing the work on the Hill to not even just to the legislation, but also to the disease community as a whole.
Thank you. Thank you for that. So I don't have any questions in the Q&A box right now. So I'm going to go on with another question for the both of you, Dr. Blackmore and Chef Walker. What gives you hope right now? Just in terms of policy and advocacy and community, or community efforts for improving the lives of those not directly or indirectly affected by FSGS, not only for those directly and indirectly affected, but also for those at greatest risk of living with rare kidney disease without even knowing it. What gives you the greatest hope to really be a change agent in that space for those communities?
Yeah, I think for me, it is seeing, a piece of legislation like this go from having 14 members to 50 members. I know that's a small number out the 435 members that are in the House, but that's significant. A lot of bills, once you start that low, you pretty much stay there, But I think that it shows us that there is the opportunity, that there are offices that are interested in pushing the needle on this issue and directing our federal resources to ensuring that, we're putting money towards the research. We're presenting opportunities to educate not even just patients, but providers, that they are screening people for this condition, that they are, like, fully being aware of all of the possibilities within this space. The Congresswoman Sewell, she is an innovation queen. She loves learning about new science and technology. And she is a member that is of the impression that your zip code and what's in your bank account should not dictate what resources you have access to, that healthcare is a right and that it should not be reserved for those who can afford to pay for super exclusive elite uh medical resources, or like boutique physicians, that, because they don't have to go through their insurance and things of that. So a lot of the work that we do on the Hill is legislation like this, creating access, creating opportunities for resources, especially for those that are on Medicaid and Medicare and that have the marketplace ACA plans, because oftentimes these are the people that fall through the cracks, because they can't afford to get a genetic testing, or because they can't afford to go see a physician or pay out of pocket, or they have to wait a year or so before they can be seen to treat, different things that's come up. So a lot of the work that we do on the Hill is to have that equitable access. And this bill definitely gives me hope that one day we will talk about this condition in the same way that we talk about HIV, in the same way that we talk about breast cancer, in the same way that we talk about colon cancer, because the work, the message, the awareness that you guys are doing for having webinars like this is laying the groundwork for us to get there in the future. Because, I had an aunt and she passed away with kidney disease, and my mom didn't even know she had kidney disease because she didn't want anyone in the family to know that she had kidney disease. And so, there is a lot of work that we have to do. Even with you wouldn't think kidney disease, someone would feel as though there's a stigma attached to that, but there is a lot more work we have to do with like removing the stigma and making it okay for people to talk about these issues and drawing awareness so that we have the platform and the foundation to do the work that we're doing on the Hill. Because look, I'm a staffer, I'm one person. There are hundreds and thousands of we all have to work together. And I last year when we had Rare Kidney Disease Day on the Hill, and I think that particular day alone, we got 9 members on this legislation. And that was just from patients going from door to door, sitting down with their members, and telling their story. And by the end of the day, we had emails. Me and Chris Jones were working on this issue last Congress. We had people ready to sign up like that same day. And so your stories are impactful. People want to know them. Don't allow what's happening in the headlines to stop you from doing the work now. People still care about this issue. It's still something, regardless of whether they want to spend money or not. We're still going to push this bill. We know it's the cost associated with it. We don't care. We're still going to do the groundwork, but we need the patient advocates more than anything, the families. Tell your stories and help us.
Thank you. Thank you. Chef?
I'm just going to piggyback off of what Dr. Blackmore said. She hit the nail right on the head with everything she just said. Opportunities like this, seeing that there are people in government that are working toward a solution, just it warms my heart. It gives me all the hope, not just as a caregiver and a mom, but as Aiden will be 18 and he'll go into adulthood at some point. So I won't manage his care full time forever, and I want him to know how to speak up for himself. I want him to know what questions to ask and how to and I want to make sure that he knows how to get access to this information. And Dr. Blackmore is right. You shouldn't only have the salary of somebody that can, afford a boutique specialist without insurance to have access to this information. That's not fair. And it's not right, especially when our community is so disproportionately affected by it. And we don't typically have that type of income that allows us to just buy our way into these rooms. This is a wonderful, wonderful opportunity. Even just being here discussing this information, this gives me so much hope. Things have drastically changed in the 8 years since Aiden was diagnosed. And having these opportunities to talk about these things and actually see the people doing the work, it makes all of this journey worth it, because as a mom and as a caregiver, I can see that my prayers are being answered.
Thank you for that. So I do have some questions from the audience. So I'm going to sort of throw them out there to Chef and Dr. Blackmore. And you guys can take it upon yourselves to either answer or sort of, give the other person the chance to. And they're good questions. So one of them that I think is really important is someone asked, how can we increase collaborative advocacy among the population cohorts who are disproportionately affected by rare kidney diseases? And I think that this is a great question, especially Dr. Blackmore, because you talked about the current climate, but also recognizing that health knows no red or blue state, And so what would you answer? How would you answer that individual who asked that really great question?
Yeah, I think, that because there are multiple diseases that make up this broad rare kidney disease umbrella, I think it's great to educate and draw awareness to the communities that are most impactful for your particular disease. I do think that the pharmaceutical and therapeutic treatment companies that are developing products in this space do a great job of bringing everyone together. But we sometimes coalition building can be very, very tricky because everyone has their own ideas on how they want to drive a particular policy or whatever their agenda is. I think for the case of HR 1518, it wasn't written in a way that just covered one group. Is a broad rare kidney disease. So this is a great opportunity to come together. And you guys are in the space, so you know the connects to make, but just have the conversations. Maybe they aren't educated about the bill, but let them know like this is an opportunity for us to work together on this, because we didn't write this bill for one particular group, but we wanted to make sure, well, I wanted to make sure that, you know, as much as possible that marginalized community and Black people in general were represented, and there was an opportunity to dedicate resources specifically to the communities. But that doesn't stop us from working, you know, with everyone under the rare kidney disease umbrella. And I'll pass it to Chef Walker. You know, I'm sure as a patient advocate herself, she has ideas on how that work can be done.
Absolutely. I feel like we can increase collaborative advocacy by having information about opportunities to get more information to advocate in the places that we frequent the most as caregivers and patients. I see a lot of churches have been stepping up, hosting health seminars, partnering with wellness organizations and nonprofit rare disease organizations to bring free information to their congregation. I also know that working in the rare disease space, different hospital systems have started to do more on the advocating side. I have partnered with Ronald McDonald House to do rare disease cooking classes. Parents, I did two different types of classes last year. One for parents and caregivers who are doing all the cooking. This is how you need to cook for your patient, for your loved one. And then I did another one for kids and teens. This is how you start to take on the responsibility of your illness for yourself and advocate for yourself, learning how to do things. So if we continue to kind of move in an unconventional way, I think sometimes people look at, well, how do we get adults together to talk about these things? Support groups, church meetings, you know, advocating opportunities outside of dialysis. If we make the information readily available in the unconventional spaces, I believe that we will have a lot more participation from the rare disease community to the health and public policy side, joining forces to make things happen.
Yeah, thank you. Thank you for that. And, you know, and one thing I do want to add about this bill, HR 1518, you know, I've been seeing and reading this bill for the last few Congresses. One of the things that always dawned on me about it is that this bill sets up the whole of the kidney care, rare kidney disease continuum for when we have therapies that are on market, the system is ready for it. So we have everything from raising education and awareness among both providers and patients. We have awareness about screening through, you know, just increasing screening and increasing surveillance. We have, you know, pieces to say to HHS secretary, hey, like, look at this and what are some of the policy recommendations you have? And I think that getting the whole system ready through this bill so that when we have therapies on the market, I think that's going to be a really pivotal point of really turning the corner in terms of some of the numbers that we're seeing. So I think that thank you for both of your feedback. I'm going to go to the next question. And someone asked, how do we increase productivity of physicians in screening and diagnosis of rare kidney disease? I don't have an answer to that.
I don't think that one is a little bit tricky, but like I stated in my opening, this legislation does call for fellowships for providers to learn about the rare kidney disease space. You know, so there is an educational component for providers to have an opportunity to learn about for the rare kidney disease. Because look, I'm not a medical doctor, but I know that medical doctors don't always learn about every single condition during their medical training when they're in medical school. And so that is why different pieces of legislation does set aside money to have provider education so that providers know to screen patients for rare kidney disease when they're presenting certain symptoms. So hopefully in the future, when we can get this bill across the finish line, there will be opportunities for providers to continue learning. And I guess we can also talk about opportunities that we can have even now for providers to be having these discussions, especially about a disease that impacts the Black community at such an alarming rate.
I had one thing before, Chef, before you hop on. And Cameron, you talked about something when you talked about the fellowships that are in the bill, which are key. And it really touches upon, Chef, what you said, which is that the first providers that your son went to weren't trained or aware of the rare kidney disease anything. So you were going down this sort of rabbit hole and you weren't being guided by someone with the expertise. The other thing I do want to add, though, is that, FSGS is just one rare kidney disease in nations outside of the US. So there's for example, Japan, there's a rare kidney disease in Japan, IgAN. The impact on individuals of Asian descent parallel those of FSGS for people of African and Caribbean descent. They routinely screen for IgAN among children. It's a routine part of their screening process. And so I think I'm throwing it out there because I do think that there's worthwhile, to your point, Dr. Blackmore, what we know about rare kidney diseases, sometimes you don't have to have like a symptom, because by the time you have a symptom, you're already on the downward slope to something catastrophic. But if we know that it's sometimes genetic and it affects certain people of color, maybe there's room for having it just be a part of just the routine screening, so that we catch it as early as possible. So sorry, Chef, I'm going to throw it to you because I know you want to.
No, I love everything you both have said. You both have answered it perfectly. I want to go back to what you said earlier about how we need to start with just urinalysis and blood testing. That needs to be routine at follow-up appointments. I love that. It's like we need to start at the very, like, what can we do first step to even before we even put our doctors in a position to have to get this information for us. What can we do first to put us on this track to advocating for ourselves? Those two simple tests, starting there, and just, talking to your doctor about your family history and seeing, what do I need to be looking out for? What do I need to be paying attention to? What preventative measures can I take? Building that relationship. All that is extremely important, but both of you answered that perfectly. I have nothing to add to that.
Yeah, thank you. And I'll be the first to admit, and I think Dr. Blackmore knows his story. When I first heard about FSGS, I actually kind of got an attitude with my doctor because I've never been screened for this. So I had to go in there with a little bit of a theme song and say, I need to get screened for this. So I think that there is a lot of power that we all have. It's just knowing what to push for and what to ask for. So I know that we're close to sort of the end of this at 1 o'clock, and I want to be really sensitive to everybody's time. So I do want to sort of wrap this up, and I wanted to defer to both Dr. Blackmore and Chef Walker to sort of any last closing comments that you have before we sort of wrap this up and folks go off and enjoy their weekend. So I'm going to start with the chef, just closing comments.
I just want everybody to understand that this is a disease that really affects our community. It is a rare disease, but it's not rare in our community. And just doing simple things like talking to your family about medical history, getting screened early, I promise you it will change the trajectory of the health in your family, because us going through this journey with Aiden, him already having a chronic illness, and then learning that he had a second chronic illness that was actually more detrimental and more harmful, has made this journey very difficult. There was no time. When I tell you how aggressive this disease is, there was no time for other options. He was on dialysis at 8 years old, unaware of what was happening to his body. A lot of kids, especially our children, our young African American children, are sensitive to a lot of different medications. We do not metabolize certain medications the same way as other ethnic groups. So figuring out what works for your loved one is a really, really important part of this journey. We wasted a lot of time, months and years in the hospital, just trying to force treatments to work that were not going to work for him. So I want you guys to be mindful of that. If you jump on this early, it can change things. Aiden is at a stable place right now, but to be quite honest, he does not have a path forward medically. He is not eligible for a fistula because his cardiovascular health is so poor due to the years of blood clots and scar tissue buildup in his body and cardiovascular system from this disease. He's also had 2 transplants that did not survive due to the recurrence of this disease. So when I speak to the idiopathic side of this, the opposite of the genetic side, which speaks more to the autoimmune effects of this disease, let me tell you, FSGS is the boogeyman. So we have to get in front of it, and we have to figure out what we can do, because as I'm getting to an interesting part of my caregiving journey where my son is learning how to care for himself, and he will start the transition into adult medicine next year because he will be 18. I'm trying to get him as confident in his caregiving skills as possible. And in order to do that, we have to have the information. We have to talk to our family members. We have to know what to look for so that we can prevent the rapid spread of this disease. So if I can end on anything, I will say get screened early, even if you don't feel like it's necessary. Well, I don't know anybody personally. It doesn't matter. Know for yourself. Because at the end of the day, this is really part of self-care. Knowing where you stand health-wise and making it a priority. We are not taught to prioritize our health the way that we should. And we suffer, our community extremely suffers from things that, had we had known or had we had the proper information, it wouldn't ravage our community the way it does, So just understand that early screenings and talking to your family, having those uncomfortable conversations really can change your life and change the trajectory of your family's life.
Thank you, Chef. Dr. Blackmore?
Yes, thank you so much for your advocacy, Chef Walker. I have enjoyed listening to your story, and I think that it's definitely inspired me, even more so with the work that we're going to be doing on this bill this Congress. So thank you so much for just telling your story and for encouraging us to get the screening for ourselves, because I haven't been screened. So, and with knowing that my aunt passed away with kidney disease, I definitely, see where I need to like prioritize that part of my health. I just want to close with encouraging everyone to contact your member of Congress and encourage them to support this piece of legislation. Um, if they're Republican, call anyway. You just never know. And I think like that's kind of the best kept secret on the Hill. That some Republicans, they may say things out front and do things differently behind closed doors. So we can take advantage of the fact that they feel strongly about having constituents that care about rare kidney disease, and that it wouldn't hurt them to sign on to this legislation, with knowing that there's a district connect, because that district connection really moves a lot of members. So I'll just encourage you to reach out to your member of Congress. If your member of Congress is on the bill, send them a thank you email, letting them know, hey, thank you. I saw you were supporting this bill already. Thank you for supporting. Well, we just introduced this, so we don't have a lot of members. But in the future, when your member of Congress get on the bill, you could send them a thank you note, because that also helps us on the back end, if there's the opportunity to put this legislation or a piece of this legislation into an end of the year package for the budget. So thank you again for having me today. And I enjoy learning and sharing insights with you all.
Yeah, thank you so much, both Dr. Blackmore and Chef. And I love, Cameron, that you've said, please say thank you to members who actually support too. So I know that there are a bunch of questions we didn't get to. So what I will do, and I've already cleared this, I will make sure that I get all the questions to both Dr. Blackmore and to Chef, and so that you know who to answer them to direct the answer to. And then I also will ensure that folks have a way of contacting you moving forward, if they wanted to sort of follow up and have any additional ideas. But I know we're at time. So I want to thank obviously the two of you. You guys are rock stars. You inspire me. And Dr. Blackmore, you said you're only one, but you're a mighty one. So and thank you for everyone who called in. And again, a huge thanks to Travere, who sponsored this and really is a company that really is in this for the right reasons, just looking at rare kidney disease and really coming at it from how do we address the inequity in this and how do we sort of take a leadership role. So I have to say, shout out to them. And then thank you to everybody else. And if anybody has any questions, you can easily find me. I'm happy to try to be as helpful as possible. In the meantime, happy Friday, and please be safe.